I'm a chest doctor and I deal all the time with treating bacterial infections in people with cystic fibrosis. And we've noticed that over half our patients are infected with fungi as well. And the problem we have is that nobody really knows if the fungi are causing problems or not. We're really fortunate in Aberdeen to have a very active fungal group that's investigating whether fungi do cause problems with cystic fibrosis and whether the susceptibility is due to a defect in our immune system rather than the sticky mucus which we see, which is the risk factor for bacteria.
We have taken quite a novel approach here in Aberdeen to look at the CF patients, because we are specifically zooming in onto the fungal infections the CF patients are getting. And we are interested in how the immune cells of the CF patients is dealing with those fungal infections.
So what I do here in the lab is that I receive cells from CF patients and from healthy volunteers, and I let them fight against different fungi. And I look at their responses against these fungi so that we can compare the CF cells to the healthy cells to try and understand why these patients suffer from fungal infections. So we're now finishing a study that indeed shows that the healthy cells are different compared to CF cells in responding to these fungi, and that the CF cells respond in a sort of overreactive manner in which could actually explain a lot of what we're seeing in these CF patients.
I would like to show and prove that there is indeed an underlying immune defect in the CF patients, what explains why they have these fungal infections, the Aspergillus infections. And why is that important to prove? Because then we can also think about new treatment modalities.
What we need at the moment is we need support from the cystic fibrosis community which we've got, so we can get access to patients here in Aberdeen, we can actually access to patients in Edinburgh, Glasgow, and of course we will need some funding to help us do what we want to do. And the funding is actually quite important because cystic fibrosis is a rare disease. It's not really covered by the funding councils, and it can be difficult to get funding for such a rare condition. So any sources of funding are really gratefully accepted.
So far, I'm the only hands-on in the lab. So if we would get another PhD student, another postdoc, it would have incredible effects on how fast we can get our results forward and what we can mean for CF patients worldwide.